In clinical behavior analysis and behavior analysis in education, we are often supporting clients or learners to increase their tolerance for necessary but uncomfortable environments or demands that they have previously avoided or escaped. To support these individuals, behavior change plans will often include antecedent interventions in the form of new skills that can be implemented prior to or at the outset of the conditions that evoke the avoidance or escape behaviors. We might also support individuals in building new skills to help them reduce the incidences of unwanted, disruptive experiences, such as panic attacks or emotional outbursts that occur in settings where there is a high stimulation or high demands. Mindfulness strategies from the acceptance and commitment therapy approach are often effective interventions for these individuals, especially as antecedent strategies. I do want to clarify that we don't use mindfulness strategies to help clients build tolerance and acceptance of inappropriate or unsafe environments or demands. We need to ensure that there is social validity for the reason that we are including these goals in our behavior change plans. A few examples might include supporting a learner with a history of experiencing panic attacks prior to the start of an exam. Used as an antecedent intervention, mindfulness strategies might be used to help the learner calm themselves prior to the onset of a panic attack. For a learner who finds walking in the hallways at school highly aversive and overstimulating, mindfulness strategies can be utilized as an antecedent strategy prior to entering the hallway environment. For a client who experiences distress prior to logging on to Zoom meetings, mindfulness strategies can be considered as an antecedent strategy to help them build the tolerance for those meetings. The 3-3-3 mindfulness strategy is a simple technique that can be used as an effective antecedent strategy for many learners. The 3-3-3 mindfulness strategy can be taught using a modeling intervention plan. Modeling is an imitation learning intervention that can be effectively used to teach skills when the elements or components of the skill are already within the learner's repertoire. We've covered planning and implementing modeling interventions in previous trainings, but a quick review might be helpful as we apply it to teaching this specific strategy. In imitation learning, a learner is copying the behavior of an instructor. So the modeled behavior is a controlling variable for the learner's behavior. So the behavior has to be modeled before it is imitated, before it's copied. So it can't just be described, but it has to be actually performed. And the imitation of the behavior should have formal similarity to the behavior that's been observed. It shouldn't be a variation of the behavior. And the imitation should occur directly after the modeled behavior. So it's a repeating of the behavior that's just been observed. Effective modeling procedures require attention and focus from the learner. They also require reproduction of the behavior and motivation of the learner to reproduce, to repeat, to copy the behavior that they've just observed. Also, an effective modeling procedure intervention requires that the learner has the physical ability to perform the behavior. So it's important to ensure that there are not variables such as a lack of mobility of a limb or inability to form a vocal sound that will interfere with the success of the intervention. For imitation learning to occur, the models don't have to be physically present. They are usually visual, but depending on the behavior or skill, this is not always required. So great modeling will often occur in person, physical modeling. The person is right there who is demonstrating exactly the behavior or action or skill that's to be copied. But we can also have imitation learning from video modeling. So someone can watch a video, they can watch a recording of somebody doing this particular activity or skill, and they can copy that, and that is also a form of imitation learning. And finally, we can have some graphic modeling. So that might be photos or graphic images that somebody follows, and they're able to track those images and copy those, and imitation learning can occur that way as well. So I did say that all the models don't have to be visual. They usually are visual, but in some cases we're teaching a verbal skill, and so the modeling might be audio, so they might be able to hear something and then repeat it. So this will often happen if it's a language skill that's being learned, maybe a new word that's being taught. If you've ever learned a foreign language and you've heard the audio of that language, either somebody spoke it in person or you listened to maybe a language learning app or a video and you heard it and then you repeated it, that would also be imitation learning. It can be helpful to use a planning template when you're planning a new intervention, especially early in your career. So this is a really simple one for planning a modeling procedure for imitation learning. There's no magic to this template, so you could use a different template. You can create your own. But you do want to have some key elements that you're thinking about before you implement your intervention. So you don't want to just go into modeling, oh, I want to teach the person this, let me demonstrate it. Make sure that you've planned and prepared and that you've documented that, because it is important for us as behavior analysts to keep good documentation, good records of the interventions that we're conducting. So the first thing you want to do when you are going to do a modeling procedure for imitation learning is to identify the operational definition of the behavior. What is it you're teaching? Make sure you have a really clear definition of the behavior or skill that you're teaching. Next, you want to identify the social validity of the behavior. Why is this behavior important for the individual who's learning it? Next, what resources are required? What are you going to need in order to teach this effectively, to demonstrate this skill? And make sure that you have access to those resources and that they're reasonable resources. Then you want to pay attention to the environment. Where are you going to teach this? Where are you going to model this behavior? So I think this is really important, especially if you're going to use maybe a video modeling. Where are they going to be? Where are you going to be? Is that the proper environment to learn this new skill or behavior? For example, I wouldn't want to learn a new golf swing. I wouldn't want to be practicing a golf swing in my kitchen, right? I might want a space that's outdoors or has more space around me so that I'm not going to knock things over. So what is the appropriate environment for teaching this skill? Next, I'm going to identify what reinforcement am I going to use. In a lot of modeling procedures, when we're reinforcing the imitated behavior, we're reinforcing the correct copying of the behavior, we're using verbal praise as our reinforcement. And so that's a common reinforcement, but there might be another reinforcement that you're using that helps motivate the learner to copy the behavior correctly. Then you want to think about how long is it going to take to do this modeling procedure intervention. So how many sessions do you think you're going to need to have in order to teach this? And you're going to want to put that in your planning as well as your criteria for mastery. What does it look like for success? What do we consider successful copying of this behavior, successful imitation of this skill or behavior? And what assessment tool are we going to use? And you want to identify all of those up front so you know. So I've put in here a little example of an intervention that I teach. Very simple. It's a belly breathing intervention that I teach to help some of my clients who maybe have some anxiety or stress, and we're trying to manage that a little bit better. We're going to try to break some cycles that lead to some problem behaviors. So this is a belly breathing activity, and so I write down all of the things, so it only takes like 5 minutes. That's a short time length for me. It's socially valid because good breathing activities and good breathing habits have good health benefits, reduce stress, lower blood pressure. There's all kinds of research on this, and increase feelings of calm, which can help improve their ability and willingness to engage in other positive behaviors that we're looking for. So I put all of these things down. I write out each of the steps that I require. What does it look like for success? What kind of assessment tool am I going to use? In this very simple modeling procedure, I use a visual observation, but I could have a checklist. I could do that as well. So I just put all of those things. I don't need any resources or material for this intervention, so that's great. And so you'll just fill out your little form, and I put that in my records, and I know that I have it, and then I'll put a copy of that for each individual that I am using this intervention for, because it might change a little bit. The amount of time it takes to teach a skill using modeling procedure might be different depending on the individual. So you do want to plan carefully and make sure that you document that planning in your files. Okay, so we've had a quick review of modeling and imitation learning intervention. Now we can apply it to the 3-3-3 mindfulness strategy. It's not the only skills acquisition intervention that we could use to teach this strategy, but in many cases, it's a great option. As the name implies, this is a 3-step procedure. The order that I teach this strategy in is breathe, move, and look. I teach my clients to take 3 deep breaths. Usually, we have previously done some breathing exercises, so this practice is not new or foreign to them. I teach my clients to follow this step by moving 3 body parts. The final step I teach my clients is to open their eyes and name 3 things they can see. The way I teach these steps is to model the steps and then have them imitate or copy me. Take 3 deep breaths. Move 3 body parts. Look around you and name 3 things you see. I see a coffee cup, I see my glasses, and I see my phone. And that's it. Those are the 3 steps that combined make up the 3-3-3 strategy. Once you have modeled the strategy completely to your learner, you may choose to break it down into 3 steps. So you model the first step, they copy that step, you model the next step, they copy that step, you model the final step, and they copy the final step. Or you may choose to have your learner copy the full strategy after watching you model the full strategy. This decision should be based on the individual client you are working with. It is important to give the client multiple opportunities to rehearse or practice this strategy and to give them feedback on their efforts and successes, as well as any needed guidance or corrective feedback. The 3-3-3 mindfulness strategy is a 3-step procedure with each step chained in sequence that can easily be modified and customized. In general, individuals should always start with the 3 deep breaths, but the other steps can vary. For example, when they are practicing this strategy, it doesn't matter which 3 body parts they choose to move. So it's easily modifiable if they are sitting at a desk or standing in an open space. Sitting at their desk, they may choose to wiggle their fingers, roll their shoulders, and nod their head. Standing in an open space, they might shake their arms, stomp their feet, or stretch their back if there is room. For this step, it's all about what the individual prefers. And the final step, this can be done silently or out loud, depending on the appropriateness of the situation. For supervised unrestricted fieldwork, you may choose to plan a modeling procedure to teach learners you are working with the 3-3-3 mindfulness strategy as an antecedent intervention. If you complete the modeling planning template and send it to me, I can provide you with feedback prior to your implementation of the intervention. This is a good intervention to record as you deliver it to a client, to use as a client contact for observation. But keep in mind that delivering the intervention is restricted fieldwork.